when you introduce VPro into the game, you can change aligners very predictably, blue and black movements in 7 days. Some people allow it to go in 5 day. I'm pretty good in 7 day personally myself. 5 minutes a day. My patients want to use it twice a day. I'm happy to let them use it twice a day. It's not going to hurt them. And then it's up to you. How often are you going to see these patients? Do you want to see them every 12 weeks with that first set of aligners? If they're into a bigger refinement stage or longer, some doctors stretch it out as long as 16 weeks. This is your call, what you want to do, but you will see your patients will have much better compliance. If they don't have compliance, they're going to look like they have better compliance because they're using VPro, which allows those aligners to stay seated on those teeth and do what they're supposed to do. So I am using VPro virtually on all of my cases right now. Some I charge for, some I don't charge for. It all depends on the difficulty of the case. But I know at the end of the day, if I'm charging for it or not, I'm going to profit. I'm going to have a higher profitability knowing I'm having one set of aligners versus 2 or 3 sets of aligners at the end of the day. So what are our benefits? Reduce visits per case. It adds value to your treatment. It sets you apart from that person who they've gone on 3, or 4 consultations already. You're the only one who talked about this device, this VPro, and then you show it to the patient, and it's very benign looking. Oh, I just have to bite on this 5 minutes a day, and I can do 1 week aligner changes. I'm going to be done in 6 months or less. That's amazing. And you know that if they're not giving you the full 22 hours a day, if they're giving you 18, 19 hours a day, 20 hours a day, this is going to help compensate that. Okay, so it improves that patient experience. It reduces the need for refinements and that extra treatment time. We don't want that extra treatment time. I'm going to stress over and over and over. It is not for free. You don't pay a lab bill for it, but it costs you at the end of the day. So here's the question. Do you include it with the treatment? Do you just throw it in there knowing, you know what? Mars just showed me I'm cutting my profitability in half. Do I want to spring for $449, just give it to the patient, or do I want to charge the patient for it? So the question is, if you charge, how much do you charge? So the average charge runs between $400 and $700. Again, if you buy these in bulk, you can get the price way down on them significantly, but you decide what you want to do. If you're going to upcharge for it, then it's no expense to you. If you want to include it in the cost, that's your call, what you need to do at the end of the day. But you're going to see, and I'll show you a couple cases soon, that this is going to allow you to do much, much more difficult cases that you never envisioned, never imagined that you would be doing. You're going to be doing now.